Guten Abend aus Mannheim, good evening from Mannheim. Welcome to our second ZDW book talk. I'm very happy to welcome Joshua Gans from Toronto to us via online system, but still he's great to have you here. We are introducing his book. You can see it here, The Pandemic Information Gap, The Brutal Economics of COVID-19. Joshua is a professor for strategic management at the University of Toronto. Before he was a professor at the Melbourne Business School, has a PhD from Stanford and an honorary degree from the University of Queensland. And actually, to get into the whole picture, he's a microeconomist. So typically, we talk about business cycle policies and stabilization policies, and there's a lot of macroeconomics in it. He's a microeconomist, and so he gets into the depth of the problem and the issues we have to discuss concerning Corona. So I'm very happy to have you here. It's glad that you made it and that you could come to us. And the way we will proceed, he will present his book and some thoughts about it in the next 15 to 20 minutes, and then we will have the discussion, a chat about the issues which come up, which are really important issues which will come to us as well. Vaccination, who becomes vaccinated, what's the right lockdown strategy, how do people behave, because as soon as you think about micro, it's not just setting the rules, but it's people behaving in a system. So that's the topic of tonight. Thank you all for joining, and Joshua, I will give the floor, at least the screen, I will give the screen to you.
Thank you so much, and thank you, ZDW, for inviting me to present this book. As was mentioned, the book is called The Pandemic Information Gap, The Brutal Economics of COVID-19. It was published by MIT Press recently. It's actually kind of a second edition. A first edition with a different title was out in April, but this was substantially extended, as you can imagine. And I would probably do more stuff to it as well, because it's kind of unusual to write a book during a crisis. But the reason I did so was there were just so many economic issues being thrown at us. And I thought that there was a role to be able to process them and to explain some of the thinking behind them. And during the course of that, as I'll explain here, I came to see the pandemic and the problems we faced as very different from how it was being discussed. People were discussing it mainly as a health problem, which of course it is. But I see it as also, especially in terms of its economic impacts, as an information problem. And so that is the direction the book and everything else I've done alongside it and after it has reflected. So one thing that happened, I wasn't the only economist to suddenly switch fields. I don't know what we're going to call this. There weren't a lot of economists working on pandemics. But all of a sudden in March, there was a large pivot, and lots of people have been working on it. And part of my role was to absorb that literature as it came in real time, because it was very useful. Now, you might think in terms of economic aspects that you would deal with, you'd be focused on things like unemployment, income support, national debt, price controls, all huge issues that we're facing. But that's actually not the direction I took, partly because I'm a microeconomist, and partly because those issues are still being played out. No one really knows what they're doing. Let's put it that way in that, and we certainly don't know the long-term consequences. So it's not really great for book fodder. But let me go on to my main thesis. My main thesis, and this is really, as we see it, I mean, I looked at the numbers in Germany for COVID. It's not good, despite earlier successes. It's not great here in Canada either. But fundamentally, my view of pandemics, despite the mess we find ourselves in, is that they're actually manageable. They're fundamentally manageable things. It's going to highlight the fact that we didn't manage it. That's going to be the controversy here. And the way you do so is if somebody becomes infected with a disease, What you want to do is you want to take that person and you want to isolate them from everybody else until they come better, and then you return them. If you can do that for everybody who's infectious, you don't have a pandemic. Simple as that. I know that's a very obvious statement, but that fundamental goal doesn't seem to guide all of the actions that were taken and how we should think about it. If you don't manage a pandemic in this way, you know what happens. It spreads. Everybody becomes infected, and that's no good. If you don't have this process by which you can identify infectious people and isolate them, well, what you're forced to do if you're going to manage the pandemic is something far drastic. You're forced to basically take all these people and treat them all as equally infectious. Everybody's dangerous, not just the one person, but the many. They're all infectious, and so you isolate everybody. You treat everybody as you want an infectious person to be treated, which of course gives rise to the economic crisis. The problems with this, of course, are you might do that, or you might have this. People left out, still spreading. And that is kind of what has happened to bring about this. So the reason why we want to manage pandemics is to avoid this situation here, because this is when you get all the economic cost. What you want to do is you want to have an information system that can identify infectious people very quickly and isolate them. So sometimes the virus helps you out. I mean, if this virus caused infectious people's nose to light up like Rudolph the Red-Nosed Reindeer, it'd be very easy to identify them and isolate them. So what we want is we want an alternative to that red nose. We want to up our information systems so that we can identify these infectious people and isolate them quickly. That's really what it is. And that is the fundamental information problem here. Who are the infectious people? How can we get them quickly so that we can stop them spreading the disease to others? And that's all about the data that we can gather. And that gives rise to all sorts of different end games. Now, end games we normally run on things like achieving immunity by either letting the virus run its course, which is very costly, or even a vaccine, which we're going to get in about 2 years resolution to the virus, which is also costly. What you really want to do is you don't want to do any of those things. Immunity is a terrible way to go. You want to suppress the virus. And the way you suppress the virus is by testing, tracing, and isolating the infectious people. Then you can be done with this virus in a matter of months. There's no real big pandemic. You have low health problems and you have low economic problems. And we know you can do this because it's been done. This was SARS in 2003. This was the total extent of it. It was a 6-month crisis. Hardly went anywhere beyond a couple of countries. And now SARS, the reason that happened is SARS helped us out. People became symptomatic prior to being infectious. So you could see their symptoms and then you could isolate them. Look what you can do when you have that information. And that's for a far more deadlier and far more infectious disease than is COVID. And we know this also because we did it again with MERS just a few years ago. MERS had an outbreak, same way, very deadly. 50% of people who catch this thing die. It's terrible. But you could identify people very quickly. And so that was good. And so that outbreak was a couple of months, mainly impacting on South Korea, who, not surprisingly, learned their lesson from all this. So you can see the lessons learned. If you look at the countries that have managed to deal with this, Taiwan, South Korea, countries that had experience with SARS and MERS, had in place testing regimes right from the start. They understood this was an information problem. They understood we didn't know if people were showing symptoms and spreading the virus. So they did the molecular chemical equivalent, and they tested people. And they tested people extensively. And these countries have done that and have managed to suppress the virus while keeping things at pretty much normal. No big lockdowns, no nothing. That's quite, it should give us pause. there was nothing sitting there that would prevent this from being done in other places. Yet, we're still stuck in this morass. And the impact is huge. South Korea, hardly any reduction in its level of economic activity. There was some, that's part of the world, and also people take precautions. But if you compare that to countries that had to have big lockdowns, Spain, for instance, huge, massive reductions in economic and social activity, hugely costly. You just don't want that. So the theme here is the pandemics are manageable if you can solve the pandemic information problem, which is, very simply, identifying infectious people quickly and isolating them. So I envisaged, actually, in one of the chapters of the book, that we would move to a situation called the testing economy, where we were actually testing large amounts of people all the time. It was an obvious route by which you could solve this problem. But countries have not done that. We have not actually done that. And the reasons why we'll be unpacking for years. But one of the issues was that the tests that we had were these gold standard PCR tests that get used everywhere, mostly. And they're very, very accurate at detecting any level of the virus in you. So much so that if you come up with a much cheaper test, something that costs a couple of dollars rather than $100 to administer and returns results really quickly, medical people were saying, well, they're not as accurate, so we can't use things that are not as accurate. But from an economic point of view, there are trade-offs. But actually, as I wrote in this paper here that I published in, I don't even remember now, a few months ago, we're not actually even interested if someone is infected with the coronavirus. We're interested only if they're infectious. And we get some help. We get some help from that because we can, you are more infectious when you have a very high viral load inside you. So at just the point that we'd be worried about comparing this big PCR test with some of the cheaper tests that are smaller, as you can see, in terms of scale, and also cheaper and also quicker. The time when we want to know whether someone's infectious, there's going to be large agreement between the more expensive tests and the cheaper tests. So in fact, the cheaper tests get you exactly the information you need, with the advantage of getting it cheaply and quickly for you. So it's very much a false trade-off, this so-called accuracy. But because people weren't focused on the information problem, and because people were thinking about health and diagnosis, they weren't pushing to adopt these tests. And so here we are, 9 months into this thing, and we still don't have broadly available testing to be able to detect whether people are transmitting or not. This is a monumental failure. So again, just to highlight here, this is the viral load of the test. The rapid tests capture only the top of the virus. The PCR tests capture more of it. But that's okay, because the rapid tests overlap with the time you're infectious. So if you can give someone a test and you can see if they're infectious and deal with it immediately rather than deal with it a day later, that is what you want to do. That is what you want to do. And so this has been confirmed ever since I did my theoretical paper. It's now been confirmed that this is the case. These tests perform in this way. Basically, at a very high viral loads, there's almost 100% agreement. And some countries have taken this on. Slovakia most recently decided to test most of their population using these rapid tests. It did an intervention over a couple of weekends, testing multiple times. They dropped their infection rate immediately by 50%. Liverpool's done the same things, dropped it by 2/3. But here's the problem, is, that can do something. It's definitely helpful. But you can see here from this graph what happened when they stopped testing. Well, the problem is the information problem is an ongoing information problem. It's not a once-off information problem. And so in Slovakia, and actually it's worse than that. This was, I prepared these slides a few days ago. Slovakia is now back up to where it was. And so we have to think about these things in terms of systems. They're not just once-off interventions. I mean, unless we could coordinate it worldwide, which, let's face it, what are our chances of that? And there are other things we can use to complement testing. Testing does this. The problem is, of course, if you isolate, it's fine, but you might have already delayed that, so be one step behind. But if you have contact tracing, you can understand if someone's been exposed even before they've been tested, and you can isolate them and get one step ahead. So contact tracing is something that in some countries can work. In fact, in Japan, that's what they exclusively rely on, much more than testing. And Japan has had a relatively good time of this. So, you know, there are different information measures you can use to solve the information problem. But if you do so, rather than having the outbreak go like this, up and then down and spend a long time, you can really suppress it and get it down to low levels. In fact, you can get it all the way to zero, as some countries have shown. And then you can just manage outbreaks sporadically because you have good surveillance and other things like that. Again, pandemics are manageable. They're manageable problems. So I've been working a lot on this. I have a newsletter now, which is probably even more writing than was in the book that you can subscribe to here, where I write about all of these issues and updates and other things that are ongoing. But basically my message in the book, and the book does deal with other things as well, which I think we'll get to, of course. This is a complicated, multifaceted system. But fundamentally, if you view it as an information problem, and if we set up systems to deal with it, and we can do so now, it's not too late. You know, this is not something, oh, well, it's too late now. We can do so now. It's going and ongoing, and I'm working on some things here in Canada to try and do that, because this crisis is not nearly over yet, and the economic crisis most definitely is not. But we really could do a lot of good if we really upped our game here. There you go.
Yeah. Thanks, great. So you really boiled down your book. Yeah, so I must say, you know, the book has many more chapters, and we will come to some of them as well, but he really made his main point, you know, it's testing, getting the information right, and that will be, you know, the big step forward. Let me, before we come to that, and well, you have several questions, you know, and it's, I can't just, you know, can't just say, you know, if you test, the crisis is over. Yeah, but so I have several questions. But one thing I want to ask you, which really impressed me, I saw some video of you in, I don't know, in May or June, and you said in that video that we will have a second wave, for sure. We will have a second lockdown. And, you know, at that time, I was also wondering whether we will have, but I couldn't say it for sure. So what made you so, you know, you were right. So what made it that you were so sure about it, that we will get to a second wave and a second lockdown?
Well, you know, it's so funny, because at that time of that video, we had the outbreaks in March, April, May, and then it was, in the summer, it was starting to come down. And but it was still there. And the thing I kept on reminding myself was, when I first got interested in this issue, there were only a few cases in a lot of these places. You know, it wasn't readily apparent. And that situation still existed. And at the same time, you know, I think my view of this is, people are managing the crisis themselves, but imperfectly, because it is a thing. So what you do is if you notice that rates are going up in your area, then you sort of start to cut back on some of the more risky activity you're doing. If you notice they're going down, the reverse happens. And so in the aggregate, we tend to reach some sort of equilibrium with respect to these things. And so I saw, you know, here in Ontario, we were popping along at 100 cases a day. And so it didn't, you know, is that really, there's no chance of you contracting the virus and stuff. But part of that was we were in the summer, and at least, you know, I don't understand how all this works, but weather really does tend to matter, UV light and all sorts of other things in terms of how quickly this virus sort of hangs around and spreads. So people were saying, when it gets colder, it's going to change. When people were out in the summer, they were outdoors. There was less chance to be spreading things. So when they were actually interacting, whereas once it gets colder, people start to interact indoors. And there's another thing to it too. And this is what's so brutal about it. It only takes a little bit of change in everybody's behavior to cause a big change in cases. It's really like that. And so it seemed to me that this seemed like a respite and there was the second wave coming, and we just needed to prepare for it. And I was hoping we'd prepare with testing and other things like that. But I think, it was very hard for people were tired, and politicians were tired, and they just could not get that act together. And so that's even occurred, even in a country like Germany, who did so well. This stuff comes back. It's not because there was some big problem. It's just because there's a tiny little change, and that causes this to suddenly blow out. It is very, very brutal. Very brutal. The only way to get around this is if you've got so few, like in Australia and New Zealand, you get a change, then you have some big lockdown, and you can get it all the way back to, if you get it to 0, you can do a lot. But if it's just there, it's going to explode. And I think they're telling us we're going to have a bad few months. I think that is true, because no one understands how this is spreading.
No, it's actually, in the end, it's behavior, and it's microeconomics. But I was very impressed to see that, because I read that about the Spanish flu, and the Spanish flu, they got mutation during summer. So it's a different story. It's not the behavioral story we have here. Yes. So, but then let's come to your main thesis. So it's all about testing. So I did some algebra. Yeah. We are here in Mannheim. We have 300,000 people living in Mannheim. And the test has, there's this test reliability, and you made this point, it doesn't matter, it doesn't have to be perfect. Yeah. But, tests are quite good. It has this sensitivity. So sensitivity means how many people are, who are infected are identified as being infected. And it has this specificity. Specificity means those who are not infected, but the test says you are. Yeah. So that's the specificity. So coming to Mannheim, yeah, and suppose, and I guess that's kind of the data. You have a mistake of about 1 to 2%, whether you catch the person who is infected, and about 2 to 4% to get someone wrong. Yeah. And so with Mannheim, if my data is right, so we have about 2% of the population are infected in Germany. Right. Then you would test in Mannheim, about 5,000 will be infected, and about 6,000, which is 2% of these 300,000 will be tested positive, but they are not. Yes. Yeah? So if we test them all, we get that figure. And so you would say it doesn't matter. We take these, all together, we have about 10,000, 11,000 people. We isolate these 11,000 rather than isolating all 300,000. Yeah, that would be your strategy.
That's one way to look at it. The other part, and I think this is the more critical part, and I don't have this in the book because I developed this, came to understand a bit more later. It's the frequency of it. So there's the thing you get from regular testing. Suppose you just test everybody once per week. You're testing everybody in Mannheim once per week. There can still be spread and things like that. But the thing is, with that cadence, you get a chance to put breaks at different points in. Because the real problem is not just an infection, I infect you, but how many people I infect. But if I am stopped at some point and isolated quickly enough, that number goes way, way down. And so the frequency with which I dip into the pool. So, when there's low rates like this, once per week can make a huge difference. When there's slightly higher rates, it's twice per week. If some people, if you can test the people who happen to be moving around more frequently than the ones who don't, you can even do better. So that's the whole logic going on here. So it's not just, there are things with errors, but you make up for the errors by the frequency.
There are, there are two issues. One is that, which you might call political issues. One is we don't have so many tests. Yeah, so these fast speed tests you mentioned. Yeah, we don't have the right size for
Right,
the,
right. But that could be changed. That's
fair enough. I agree. And actually, you could argue, we were too slow during the summer, or we, politicians, the society were too slow. We should have more of these tests. And second, but that's, I'm not sure, maybe I could ask, how is that in Canada and the States? Here, only physicians are allowed to do those tests.
well, but that's a choice. And that's happened here as well. I mean, so one of the things that happens is, with respect to any of this stuff, there is public health people tend to be very protective and distrustful of other people. They've been very burnt because, people smoke, they drink, they don't watch their weight. So they don't believe that people will behave. And so when it comes to things like testing, here's what they're worried about is if I give you a test to take it home, and then you do the test, are you actually going to comply with it? Are you actually going to isolate yourself? So they say you should go to a doctor and do it properly. But of course, the doctor would have to enforce that anyway. So I don't see the difference. But, this is the discussion going on. Or people wouldn't apply the test, they're not capable of it or can't. It's a trust issue. The problem is that we're in such a crisis that predicating our entire strategy on a relatively unfounded view of people's behavior in a crisis seems like an error to me. It seems to me that you'd want to try these other things. And so, yes, those tests are currently expensive tests in Germany. They're currently applied by a medical professional. But that is the choice. That is a choice. We don't have to make that choice. We can make it a different choice. We can say everybody gets tests. They're cheaply available. You should take a test before you go to things. And so on one level, we could see what happens. At others, we could add some extra constraints. For instance, if you were going to a school, coming into one of your buildings at ZEW, you'd have a test before entry. And that test doesn't have to be done by a medical professional, but it could still be done by another person or monitored by another person. So there is lots of different ways of being able to do this, to be able to collect this information. The fact that we seem to be so reluctant to try is a mystery to me.
Actually, one argument being made is that, it doesn't have, the test doesn't have the same reliability if it's done by laymen. Yeah, and I would agree, but you make this point, it doesn't have to be perfect. Yeah,
no.
Test doesn't have to
and
be
actually
perfect,
they've tested that too. I mean, people have done some studies of that, and it's not that much different. You're basically sticking something up your nose. So it turns out that people have been able to do it themselves. So, again, that was an assumption. It could be the people were terrible at it, but, it turns out that probably isn't an issue.
So we have in Germany about, what is my figure I have here? We have per week 1.3 million tests. The United States, it's about 12 million. In Canada, it's about 2.2 million. So I guess still some way to go. But one argument they make is, the health ministry in Germany, that if you test, they only test if there's a reason to test. Yeah.
Right.
So and they testing without a reason, it leads to a wrong feeling of security, of safety. That. But that for me is a behavioral issue. So it means that I'm tested positive, but maybe I'm not. I'm tested negative, sorry, and maybe I'm not,
right.
and so I feel safe. But if it's a small number, it should be fine. Yeah.
So look. So there's two views on that. One is, of course, people are going to feel safer and might take less risks. They still could go out if the reason I'm going to feel safer is because I know other people are getting tested, and they're all walking around negative. Well, one answer to that is maybe you are safer. Maybe that's the point. My goal in solving the information problem is not to get rid of the pandemic. That's one thing that it can do. My goal is to make it safe enough for us to resume our economic life. So if the effect of testing is that we can go back to a normal economic life, but have no big outbreaks, we might still have some of the pandemic going on, well, then that's pretty good to me. So this weighting of these things, I think, is also a bit false as well. I also think it's opposed to how people actually behave. I think people have I actually think, for the most part, what we've seen is people have voluntarily undertaken behaviors to limit their exposure in a massive way. Worldwide. It's quite extraordinary. I know there's discussions of masks, this, that, young people doing stupid stuff, but from a public health perspective, this is a triumph. So I think we can go a bit more.
Actually, you make one nice point in your book. I haven't thought about it, but it's that if you become tested and you're tested positive, you might, go out because you're not afraid of being infected anymore. You are already infected. So
Right.
I guess these are small figures, so we don't have to worry about these people too much. But it's all about behavior. So it's not fully clear.
Look, if people were doing that, that would be a problem. The hope is that you have some rules, you have other things like that. But yes, so technically, there is a scenario where it's a true and complete disaster. However, again, we just don't know.
We have a few models in economics, where we try to integrate this behavior into testing models and into general equilibrium models. And also here in Mannheim, some colleagues are doing this kind of work. And one thing I learned out of that is that in kind of, you don't have to isolate the people at risk, the old ones, because they do it themselves. So
Right.
you don't need to have a strategy for them in a way, because they know, you don't have to have government rules. So I wondered whether also with testing you need some kind of segregation. You need maybe you test only the youngs or only those places at risk.
I think so. I mean, I think if it were feasible, testing when people were moving is all that's needed. You don't have to have. Some people advocate a lot of at-home tests. I have no problem for that, except that if you happen to be like myself, who's at home all the time, or I don't need to be testing myself all the time. That's just an anxiety thing. But if I'm going out, if I'm out and about, or if kids are going to school, or people are traveling or whatever, that's when you want to test. Or if I'm going to go and visit an elderly relative, I should be able to go get a test quickly for that. That would help. Or if I'm any of these employees who are doing that, people working in these things. So I posited as if the tests were free and available, because that's how I like to think about it. But as you sort of go away from that constraint, there are other things we can do. The problem is we're so far away from what would be optimal. We're so far away from it. A country like Germany is testing 1 million people a week on the normal stuff. Chances are it should be, many orders of magnitude above that, if this problem was going to be solved in this way. And that's the same with Canada, same as US. So I think it's, but I think you're right. We don't have to test everybody.
No, I fully agree. But first thing, okay, suppose we will get more tests, and they already announced that they will, I don't know, 5 times the tests of these speeds, these fast tests, I'm not sure what the English, to increase the number of them. But then suppose we have these tests, then the next point you made, so you had this nice slide, is testing and tracing. You have to there's no way around, because you can't pick them up in the beginning. So just to give you another figure, I checked this. So we have an app in Germany, a Corona app, 25 million downloads. We are 80 million inhabitants, so I know it's but this figure here I thought was interesting. So far, we have 1.2 million infected in Germany. 200,000 have put this information to the app. So it's about a 6. And half of them have distributed the information to all the others. The other said, I put it in my app, but I don't tell anyone. So I don't let my app tell everyone.
Right.
And so there seems to be a real issue, you know, and you have a whole chapter on it, you know, on privacy,
Yeah,
and you know,
yeah.
it's not so easy to say, you know, we have to test and trace because they don't want to be traced.
No, tracing is a very difficult thing. So there are countries that have taken tracing extremely seriously. Lots of information provided, monitored, credit card swipes, phone tracking, everything. And you know, if you really go at it, tracing can work. The volunteer app version hasn't been successful. Well, it was worth trying. Everybody has a phone. It should do something, but there's too much. There's too little uptake of it, and we're relying on people to enter the information necessary, and it's a bit imperfect because what we know now is the way you get exposed is by being in the same place as someone for 15 to 30 minutes plus. Well, these apps pick you up with a 30-second exposure, maybe far away or even outside or something like that. So they're kind of doing too much, which is not great. What we really need is to understand more about the network of interactions and the network of your own interactions. So there are these apps that have got developed now, but haven't been uptake enough, where they can measure all the people you've been in contact with and all the people they've been in contact with and build a network of the entire economy. And then if somebody like 3 steps away from you becomes infected, you can get an alert saying someone 3 steps of you has become infected. It has this probability of getting to you. And then you can take action before you get infected. You can say, well, I'm going to switch out from the normal mask I use to a better mask. I'm not going to go out as often. I'm going to try and avoid some of my usual contacts because somebody's got it somewhere. So it can be like a weather forecasting app, but for viruses in your network. Those are the sorts of things we probably need at this stage, but it's kind of like a little too late to work out how to get them all adopted. But certainly they've been adopting these things like on campuses and things like that, and they've been very effective. So one of the things we've seen with testing is in the US, they've been able to open up campuses and have lots of testing and keep outbreaks low so people can go about doing stuff. And that's with university students who we know are engaging in riskier behaviors. So there's some proof that we can do some of these things if we can get it focused enough. The problem is rolling out something an economy wide. That's a whole different matter, especially when it comes to tracing, which really is a whole infrastructure that is needed.
Yeah, I guess this will be presumably one of the lessons we will learn for the next crisis to come. Yeah. So, but I like this one with the network of social interactions. My network is 0. Actually, I'm my network. Yeah, I don't meet anyone anymore. But that's how it is, you know, in a lockdown.
But it's very simple. I mean, I have a kid who goes to school every other day, and so that's the only risk person outside our household. But you know, how many people? What is her follow-on risk from that? And that's the path by which it gets here. So it's a tricky thing. And everything we've delved into this thus far says the network really matters a lot.
My kid also goes to school, so I
have
a network.
You're no longer one of one.
It's not my network, but you know, sure, it's my network.
Yeah, but you see what I mean.
Yeah, one question might be of interest to you, because that's a debate we have in Germany at the moment, because the app, you know, one is the app is not, you know, not so many people have taken the app on the mobile phone, but the other one is, you know, to give the information about the infection. And what they want to do, or what some people are arguing, we should, rather than have an opt-in, we should have an opt-out approach. So kind of a nudging thing, you know, that you have this app and automatically it gives the information to your network. Yeah.
Yes.
If you don't say, I don't want it. So rather than the other way around. Yeah. So have you thought about that one? Yeah.
Oh yeah. Well, I think, I mean, on any one of these things, when it comes to privacy and stuff like that, people aren't that concerned. And so flipping the defaults is a good way to go. Again, this is where we get another set of people who come in and harm our ability to fight pandemics, and that's the privacy people. Because the privacy people want to set all the defaults such that people are as private as possible unless they release it. Well, the problem is, in a pandemic, that's exactly the wrong way to nudge people. And someone will write a paper, you can see it as a forecast, adding up the number of lives that have been lost to different privacy regimes. We'll count them in lives. Now, I'm not saying, everything has trade-offs, but we have to understand there is a cost.
No, I agree, but so actually, I wrote an article already in April with co-authors on the privacy issue, and we should be more flexible on the privacy issue. On the other hand, if the app is voluntarily, then if you have an app which has less stringent privacy rules, then maybe less people take it, take the app. So
that's true.
There is a clear trade-off, and so you could argue, only with these privacy rules evoked on the app, that's what make people take it. Yeah.
Right. I think there's definitely something to that. So don't get me wrong there, but I think we're on the other side of that equation thus far.
And then suppose we have testing, we have to work on that one, and we get tracing. The solution we are all hoping for is the vaccine. Yeah. Yes. So you also have several chapters on that in your book, and let me maybe start with the first one, the development of a vaccine. Yeah. So I think it's fair to say that's a huge success what we have seen. Yeah, and that is really surprising that we, so fast, so many companies are doing it. And you make the argument the market alone couldn't have done it. We need the government for it. Yeah. So
I think that's sort of what has happened. The governments around the world did what they were supposed to do and bought up quantities of the vaccine. It's like no much more than Canada. Canada's bought enough supplies of the vaccine to cover us like 8 times. If they were all...
That's ridiculous. I don't know how you do that.
No. I think the thinking was, and here's what's going to happen. They're not going to do it 8 times. The thinking was they didn't know which ones were going to succeed, so they placed all the bets. And then all the other ones they bought are going to be gifted to other countries. So once the plan for Canada is done, they'll all be gifted. So yeah, that was a bit crazy in some sense, but that was the idea. But I think that's worked out. But there's some stuff that we did slow down on. These mRNA vaccines were developed they were pretty much developed by March, and our way of being able to test their efficacy was kind of slow still. I think there was some room to be able to do some improvements. But that said, people did start manufacturing these vaccines right away. We've been building up stockpiles for some time. So all that is going about as well as you could expect. So you're right. That part turned out to be a stunning success. But I must admit, when I was writing that back in March, which was one of the first things I did not know how that was going to go. I was also very worried that a lack of coordination internationally might crimp that, cause too much sort of gaming and stuff. I think it turned out to be okay as well, which is nice.
No, so far I think we are doing well on the development phase. I'm not sure whether we are doing as well on the production and the distribution phase. Yeah, but with the development, just to make this argument, you say that it was good that government stepped in because the market itself couldn't have solved it. Yeah, we neither want monopoly prices and we don't also want even, no one expected to charge monopoly prices, so they were all nervous whether they can really sell their product. Yeah, so so that's why it's good that the government bought these products in advance. Yeah.
Yes, they resolved a substantial amount of uncertainty, which is really what you needed to do in order to get this going. It may be that it might have worked out anyway. People might have seen the opportunity anyway, but it was better to have some guidance than not.
So was that these advanced market commitments which Michael Kramer proposed? Is that a similar thing?
There are versions of it. They're really pre-buying doses. So it says, we're committing to buy this many doses from you when you can deliver it. So it was an underwriting of the expenses going on, an underwriting of the investing in plants ahead of knowing if the trials. So in other words, these things were bought. If they had all been dangerous, they still would have had to pay for them.
Actually, that's just because it's in your book, and I think it's a good point. These advanced market commitments were introduced by Michael Kramer, and he got the Nobel Prize last year, and that was introduced for development policies, not for us, but we have similar instruments. That was for, I don't know, getting malaria vaccines into the third world. Yeah, but maybe one ethical issue. I'm not sure whether you have thought about that one. Do you think it's okay that development means testing it, and it would have worked much faster if we pay people to test it and become infected on purpose? Yeah. I think UK is you can do that in the UK. Yeah, you can't do it in Germany. Yeah, how is that in Canada? Can you do that?
I don't think we can do it here either. So some places you can do it. The good news is you only have to find some places in the world to do it. You can do some shopping. We need some places. We don't need everybody to do it. That's harder to say. So I don't know if that would have sped things up or not, as I said, because the issue is the production of this stuff, and that was going to take some time. I suspect the next time around we will eat up another few months from this process, and we can do it even quicker still. But it is what it is right now.
So first is development and production. It's somewhere in your book, but I couldn't find it today. I think you also cite there Bill Gates, that he proposed to build, in the beginning of the crisis, several factories for the different technologies, and then you don't know which one is successful, and then you scrap all the others. Yeah. So I thought.
So I'm not sure quite what happened to that. I think the government started doing that as well. He proposed to do it. He was the first that I heard of. So basically said, well, we've got all these different sorts of vaccines, and every one of them requires a different dedicated plant. So rather than waiting to see which ones are the ones we're going to want and then build the plant, build all the plants now, which it was exactly the right call. In other words, even if you had to throw 6 of the 7 plants away, which we won't have to, it turned out, that was the right way to go to accelerate this thing. What I liked about that was understanding the nature of the economic returns to speed in ways that people traditionally don't. And that's the kind of thinking we needed.
Yeah, you call it the kind of thinking, the Manhattan Project, which we need. That it's it's a big scale thing, and we should really use different instruments. Actually, I just figure for Germany, Germany paid altogether 750 million for research and development. Yeah, in that. Vaccine. Maybe one question, because I saw some arguments that it's whether the patent system is a problem for production. I don't think so that it is, but so because you can license a patent, so if you have production possibilities somewhere else in the world, you would use them. Yeah. So
yes, yeah. So I don't think that was I don't think those things were the issue. It just that the patent system itself wasn't going to be enough to provide the incentives was my main concern. But I don't think this says one thing or another about the patent system. I think this is more about our pandemics and vaccines. There are externalities all over the place. It's the sort of thing that you think we need a plan for, and fortunately I think actually that appears to work out. The details of it will be very interesting to read about, because the one thing I find is it's very hard to know what's going on with all of this. So it'll be interesting to find out more about that story later on.
So, because testing and tracing alone won't work like in South Korea or Taiwan, so we are all hoping for vaccinations. It's the same in Canada, I guess. It's the same in the United States. And okay, so let's come to vaccination, yeah. And the tough problem will be, who will get vaccinated at which point in time. Yeah, and you call it, I
Right.
think you call it the big rationing in your book. Yeah, so we will have rationing, and actually we are doing. It's so hard to ration. So we skip those debates typically in Germany. We don't like to have rationing. Yeah, so in medical areas. Yeah, so. If I understand you right, you would say first those who are at risk and essential workers. Yeah, so I guess that's kind of consensus. Those who are at risk, and
Actually, I tweaked that a bit now. So essential workers, obviously. So the at risk is the interesting one. So at risk, makes sense. Protect people at risk. That's a good idea. But there's a problem when the at risk people aren't the people who are spreading the virus. And so you can actually, if you've got a virus that works very well, as our current viruses do, you can actually protect the people at risk more effectively by vaccinating the people who are spreading the virus and who are active. So it is not obvious that we want to be, there's lots of reasons not to vaccinate the at risk. One is, as I've just said, you might actually protect them more by vaccinating the people who are spreading the virus and stopping it being spread. Two is, we haven't done enough tests on side effects for the people who are at risk. All of our studies are not at that, and so it's risky to vaccinate people who are at risk. Yet England. Let's pick the 90-year-old first. Well, let's think about that risk. That was a very risky thing to do, because if that person has a complication and then dies, well, then we're going to have whole lots of problems of people not wanting to take the vaccine. So I found that strategy, just seemed very, very alarming to me. It didn't seem prudent at all. It seemed very political. Obviously you want to send a message, but from public health or anything else, did not seem like the right way to go. But fortunately, it seems to be okay. But yeah.
There are two issues. One is that, is it risky for the people at risk? Yeah, and I guess with better data, we will learn more about that one. And these recommendations here are also by public health authorities and by ethics committees and by the government. But the other thing, the point you're making is maybe, these are not the spreaders. Yeah, the spreaders are somewhere else, and we should, vaccinate the spreaders because they are spreading the virus. Yeah, you make one nice point, which, suppose we go that direction. We have those at risk, and we have these essential workers. We have to talk about what essential means, but essential workers. And then you say we could make a lottery for the others if we don't, and then we could have a market, so you could resell it.
Right.
Yeah,
So a lottery is a very fair way of doing it. Everybody has an equal chance of getting a vaccine early, so that's a fair way of doing it. But it may be that actually there are some people who would be willing to pay a lot to be vaccinated earlier. Mainly because they're rich. Let's not dress it up, just they're rich. And you say to yourself, well, that could be a good outcome. I mean, if I am a poorer person who gets a good lottery ticket, maybe I prefer to wait 3 months and get a nice big payment from someone rather than switch. Or, you don't have to think about it just as a resale market, just as a trading market. For instance, suppose I'm 80 years old and I get a vaccine dose, and I've got a 60-year-old diabetic daughter. Well, maybe I would want to take my dose and give it to my daughter. Maybe I want to swap my place in the queue. So not having, there seems to be real benefits to having those sorts of mechanisms. And again, let me make it a prediction. We're going to have a story where somebody gets a vaccine, they're not allowed to give it to their kid gets COVID, and then there's a problem. We're going to have those stories. You don't get rid of the political problem by ignoring these things.
No, I fully agree. Actually, the argument that the rich will get it, that will be the counter argument, and we will, and we have, it will be very hard to distinguish between, is this person getting it because it's rich or because it's really in need of it, like the daughter you mentioned.
Absolutely, and we know this sort of thing's going to go. Look at and you get into absurdities. Joe Biden has not got the vaccine yet. It's available in the US. He has not got the vaccine. Why? Why? Because, oh, well, it's not his place in turn. That's craziness. He's the president of the United States. So we're doing a whole lot of things dressing up, which I think, it's just unrealistic. And in the meantime, we are going to have some rich people get the vaccine and going to have, we're going to have that. Better to have a system that has a safety valve whereby people can sort of express with their payment some of this, than to let it go under the carpet or under, in smoke-filled rooms. That just seems to me. But I've seen no government who's been willing to grapple with any of that. At the moment, it's by age, basically, I think.
Yes, it will be a hard spring because then we have all these debates coming up here. And yeah. No, actually, I told my mother that she wasn't sure whether she should get vaccinated. I said, you take it and then you give it to me. Yeah, so. And then I can sell it, if the market... I don't know what I want to do.
Well, there's another thing that has to be done here.
Yeah.
You're going to have people get 2 doses. So it's not so simple as just taking it. And you've got to keep track of all this. Because you've got to keep track of when they've got it, because that second dose and stuff like that, you can't have it too close to each other. You've got to have it at a reasonable time. So there's an entire information layer that has to be put up with vaccinating an entire population in this way. So again...
This assumes that people want to become vaccinated, but we are also in this debate.
We have to track that too.
That they don't want to. So I know about 50% don't want it. And here one question, which is debate in Germany, and I guess it's the same in Canada: should people be allowed to wear a badge? So I get vaccinated and I wear a badge, saying it's hard thing talking, but then I can go shopping, and maybe it's good for the shops that I go shopping because I'm vaccinated,
I think there's no doubt that should be allowed. I think if you get vaccinated, you should be able to express it. I think that's how we encourage things. I think people are reluctant because there's no reason to get there's no advantage to getting vaccinated early if you're already at home and you're relatively well protected. It's the same issue. So you may as well wait and see how it sort of goes. I mean, that's a natural thing. I think by the time we're getting to the end game of this, you'll be freer if you're vaccinated, and people will end up taking it up. There'll always be some who don't get it, but we can tolerate that.
If it's some, yeah. So we are coming to an end. So maybe one thing you could tell us, living in Toronto and seeing Canada and the States. So what you think did the States, get right in this pandemic, and what will change under Biden with regard to Corona?
I mean, I think, look, I think the United States singularly, if you look around the world, you can have a lot of different governments with a lot of different capabilities manage this thing. You had to try very, very hard to do it as badly as the United States did it. It took that's an entire level of mismanagement. So I think there'll be an improvement, but I think it's going to take a while because they're going to inherit a very large outbreak and a lot of division and other things like that. So I think it's going to take a while. I would love to see the Biden government embrace testing. I still think that could do a lot of good. But at the moment, it is just managing the pandemic to keep the numbers down while people get vaccinated, which is the strategy in most places. But I would love to see a flip. I mean, in my dreams, I have a notion of a big push that we all say in March around the world, everybody's going to get tested, everybody's going to lock down, and we're going to have a big push worldwide to get this thing down. But I just don't think we're capable of it.
Unfortunately not. That's a dream.
Europe should be capable of it. Where is just as another thing, where is the European Union? This should have been their fine moment.
We need another hour to talk about the European
Yeah, I
Union,
know,
because I think
know.
in the
I'm
beginning
just
of the
raising that.
crisis it was the worst hour for Europe, because every state went for national solutions.
their
We're
own thing,
slowly
but-
recovering from that. Yeah. So
Yeah.
okay,
This was the
thanks.
opportunity for a European moment, but anyway.
No, that's right. It
too bad.
should have been, yes.
Yeah.
So thanks a lot. So I'm showing the book again. For the book, I'm curious to see the sequel to it. Know that you have learned more and more. Yeah, I'm curious to get to the next stage. And actually, we will have in the next months to come really hard problems to tackle. Yeah, which are not stabilization problems, but it's who gets the vaccine, what are the rules, do we have smart ways of distributing it. So thanks for the debate. Just as an announcement in the end, that's our ZDW book talk. We will have our next book talk in March, on the 10th of March, by Gabriel Zuckman. He's presenting his book on the triumph of injustice, so a different topic we will discuss in March. And for those who are, like our series, we also have a series on political issues. That will be the next meeting in January, the 13th of January. I will discussing with our Staatssekretär Nussbaum on China and the China strategy Europe and Germany are taking on. So, Joshua, thanks a lot for joining from Toronto. Have a nice Christmas break, end of year break, and it was great talking to you, and to all of you on the screen. Have a nice evening here in Germany. Thank you very much.
Thank you.